Hi, this is Dr. Brett Butterfield. I'm here with Dr. Kevin Millet. Kevin, thanks for joining me.
You're very welcome. Thanks for the invitation.
Yeah, I invited you, Kevin, today as an expert on a topic that I want to discuss, which is remote healing. And it's also known as non-local healing or distance healing. And this is something that I do in my practice. I'm a naturopathic doctor, and I have many remote patients that are they're not living in my city, they're living out of state or so forth. And I've had great results with this practice, and I want to make it available to more people. And so Dr. Millet is the current director of the Healing System Total Body Modification, which teaches health practitioners how to perform remote healing. And he's the one who taught me how to do remote healing. And he's also made a study of the science of quantum physics. And I think he's got some great insights for us on this matter. As a study, he hasn't taught remote healing as a religious or spiritual practice, but as a scientific method. And I think a lot of people who are first exposed to this, or they haven't had a whole lot of exposure to remote healing necessarily. And so I wanted to give them a brief explanation that they can wrap their head around. Essentially, in a nutshell, what is remote healing? How does it work? Do we need a PhD in quantum physics to understand this, or how would you explain it to us, Kevin?
Well, the immediate answer is I have no idea how it works. And I only have ideas about an idea of how it works. But in the end, I don't pretend that I know all the particulars and nuances as to how this works, except that I know how healing works. Healing occurs when there's a profound shift in the neurologic system. And every cell in the body is in a constant state of turnover except the neurologic system. The neurologic system is a sense organ. It perceives. And through perception, we can actually make changes in the neurologic system, certain aspects of it. There's a part of the neurologic system that we call in total body modification the biocomputer. In more general vernacular, people might call it the subconscious. And so healing is where you make a change in the neurologic system, which isn't a tourist in the body, it's a permanent resident. And all of the tourists that come and go, the cells of the liver, the lungs, the joints, the bones, everything else, it will modify to elevate to whatever the level the neurologic system is functioning at. So I think it's very important to understand that what we're talking about is neurologic healing. I'm not talking about setting a bone or doing a surgery or something that's very, very mechanical. The other thing I want to say is that I'm extremely uncomfortable with remote healing. I would absolutely not do remote healing if it wasn't for two reasons. If there wasn't a necessity for it, and if it didn't work. And I was in Costa Rica. I was in such pain that I knew I could not board the plane. I was finished with my trip. I was in way too much pain. It was facial and head pain. And so I reached out to someone over the phone, explained my predicament, said, I don't have anyone here that can help me. Can you see if somehow you can do something that would help me? Because I know that remote healing has been done in the field of neurologic medicine or neurologic healing, if you will, all the way back at least since the 18th century. Will you see what you can do? And this practitioner did the correction that literally did it on a hologram of my body. She was imagining me lying on the table. She didn't do anything physical to anything other than take her body through the motions that she would do if I was there with her in that moment. And she did the procedure. I immediately noticed relief. And I spent my entire flight back home from Costa Rica to the United States wondering what on earth just happened and realizing my whole reality just got shifted. And so that took me down this tunnel of, all right, well, what is going on? I've heard of the relativity of space and time and Einstein's theorems and so forth. And I've heard of quantum physics, but I really didn't know much about quantum physics. And I do want to just say that remote healing is not necessarily understood or explained by quantum physics or by any physics. That being said, it quite possibly is. And there's something we know that when particles get small enough, the Newtonian and Einsteinian physics no longer apply. It's what we call particle physics. It stops applying, and there's a whole new set of physics. All new physics had to be learned when you get below the size of a particle of an atom. When you go subatomic, which this device that we're recording and doing this interview with right now, this telephone, we could not do it if we didn't understand the physics below the level of a particle. And we call that quantum physics. And there are two phenomena that I think are germane in what we're talking about. One's called quantum tunneling, and the other one is called quantum entanglement. Just real quick, quantum tunneling is when a particle, this is a subatomic particle, is in one location and then instantly appears in another location but was never between. We know this happens. We've seen it. We can predict it through Schrodinger's wave function. And if we couldn't, we wouldn't have our cell phones, for instance, or any type of computer like that. The other one is quantum entanglement. Every subatomic particle has a spin. And when it's not entangled, it will spin right, it will spin left. Quantum entanglement is when it pairs up with another particle and they spin opposite each other. No matter how far apart they are, they could be, galaxies apart. They will spin, they will change their spin simultaneously. And so we realize through quantum physics and through string theory and a whole bunch of other things that there's a lot going on in the physical world that kind of defies our daily experiences, because the physics of our daily experiences is Einsteinian and Newtonian physics. It's particle physics. It's an object in motion tends to stay in motion, and things like that. But those all completely break down. So what I can only imagine is that when we're doing remote healing, and just to give you another example, my mother has had 2 biomedical appointments set for weeks to go and have a source of pain in her lower abdomen evaluated. She talked to me about the pain. She's excruciating. She talked to me about it, and I said, well, it sounds like this. Has anyone checked this? And she's been seeing a lot of hands-on healers in her area. And she said, no, I tested it, corrected it, called the next day. Her pain was completely gone. And she's been really distressed, thinking it was something with her uterus, something with, bowels, and those are the types of appointments she had. And so, do we understand it? We have some thoughts about it, but really in the end, the proof is in the pudding. I really don't care.
Did I lose you, Kevin? Okay. Well, until I get Kevin back, I wanted to say that I've had similar experiences. So some of the best healing sessions that I've both given and received have been from a distance. I'll be talking with somebody over the phone, either receiving or giving, and I've had profound shifts in my own health. And I've had my clients report profound shifts in healing in their health as well. And so this is something we wanted to share with more people. It looks like Kevin's coming back on, maybe. We'll see. And like you said, there's proof in the pudding. This is something that we can duplicate, we can predict. We do these procedures and we expect people to get better from a distance. So I do it much like he was saying. I see my patients holographically and I perform the corrections on them as if they were here in my office. I can hear you, Kevin. Okay, you're back. Let's see. I think the last thing I remember hearing you say was the proof's in the pudding. Did you have more to say than that?
I was just saying that in the end, the objective is to do what works. And it's not important to me to understand it. It's important of me to benefit from it. I don't really even understand why when I plug in a vacuum into the wall, the vacuum works. I don't understand all of that, but I use it every day, and that's, you know, that's enough for me. And so in the end, yeah, I try to investigate, look into these things, but we're here to help people, and that's ultimately, that's the test. And some people will say, well, hey, it's just placebo. It's just all just like mind tricks. Well, the difference between mind-body healing and subtle influence medicine and placebo is that placebo's temporary. And healing brought about through subtle influence medicine, mind-body techniques, is lasting. And anything that's lasting is not placebo. There's a change that's happened that is enduring, and that's what we're able to accomplish, whether we put our hands right on someone or whether it's through distance healing.
Yeah, absolutely. Well, thank you for sharing your thoughts with me on that. And I'm with you. I think that there's a lot of people who need the healing techniques that we have, and they're not directly in our communities. And so I think it's a big gift that we can use these with people wherever they're found, wherever they're in need. And thanks for sharing your thoughts with us today.
Yeah, I just want to add this, talk about necessity with this current situation surrounding coronavirus. We can't leave the country, right? Can't travel. So there are a lot of situations where it's great to have the option that if you're not able physically to be together, that this is available. And the consistent reports I get back is that it's very, very effective.
Yep. Yeah. I found it consistently to be just as effective as in-person healing in most cases. And I think it filled a need. And then also there is an element of convenience to it in that, my sister was just saying she just got in a car wreck and she was going to a chiropractor. Well, she had to carve out a couple hours of her day to go to the chiropractor. This is a clinic that specializes in these concussions. And so she had to get that time off of work, and it can really, really be very costly once you start adding that in. And so I think it's great that we can also help people in that way.
Well, there's also the quarantine situation. I just worked with a patient who was in a quarantine in the hospital, And her daughter reached out to me because she was losing ground against the coronavirus. And she called and ended up doing 4 sessions over 4 separate days, was able to do it because all we needed was a voice connection. And the daughter credits her mother turning around and now being out of the hospital and feeling robust and strong to those sessions.
Mm-hmm. Wow. That's great. Okay. Well, thanks so much. I want to end this here so we can keep the video brief. And thanks so much for helping me out, Kevin.
Very welcome. Cheers.